I chose UWindsor twice, actually. First, coming from high school to university, I chose it because of the low faculty ratio, so I knew that I wasn't going to be just a number. I was actually going to be able to talk to my professors and ask them things and really understand the course concepts because I could get them clarified.
I'm Carly Stam. I'm going into my 4th year of nursing here at the university, and I'm a peer mentor in the general nursing lab. I help with running the labs, facilitating them, running skill sessions. So the main job for us is to kind of help with skills. So learning dressing changes, how to work the IV pumps, doing catheters, injections, medication administration. So we just help with the skills outside of the clinical practice so that they can have a better application when they are actually in the clinical practice and they can feel confident.
The professors here does an amazing job at collaborating between clinical and theory. So what you learn in theory classes and experiential lab, you're able to apply that knowledge into your clinical with actual real-life patients. So the critical thinking that you do in theory, you're able to actually do as a future nurse in a hospital setting.
Experiential learning is the process of learning through experience, often referred to as learning by doing. It also includes a debrief. So we want our students to reflect on their experiences and apply them to real-life situations through a facilitated debrief.
Our lab spaces are simulated to look like our hospital and community placements here in Windsor, Essex. We have lots of equipment and supplies that they're the same as the hospital and community placements. So what the students are practicing on and using in the lab is what they'll see in the real world. So we maintain that by discussing with our community and hospital partners and what equipment and supplies they are using.
And it's really important to get that human interaction because these real patients in the hospitals, they are going through a difficult time. They are real people. So they also, in lab, they teach you a lot about therapeutic communication and therapeutic relationships.
In simulation, it is a very safe learning environment. And this way students can make mistakes because nothing's going to happen to our mannequin, and learn from those mistakes so that when they go into the clinical setting in the hospital or in the community, they feel better prepared.